Assalamualaikum warahmatullahi wabarakatuh. We are from Group 1 and we are going to present about the pesticide toxicity. So this is our flow of this presentation. The first one, I will explain about the summary of the trigger, followed by the introduction and causes. And then we will also present the organophosphate and the effect of the exposure, and then followed by the treatment and prevention, and lastly the conclusion. Okay, now so I will explain the summary of the trigger. A 29-year-old man was brought to emergency department unconsciously. He was reported to experience headache, nausea, and also weaknesses. The physical examination showed that he had fixed pinpoint pupils and generalized paralysis. He had a high blood pressure, slight fever, and also normal heart rate. Mucus secretion also are found in his trachea, and doctor prescribed him with naloxone. However, it did not work. And upon investigation, it was found that he was mixing pesticide for his oil palm tree spraying at his family orchard. And soon he notified that there was a spill in the chlorpyrifos formulation on the floor at the area 2 days ago. After the treatment and antidote therapy, the patient regained his consciousness within 4 hours. So from the trigger, there is a clear possibility that he was suffering from pesticide poisoning, and in this case, it was chlorpyrifos formulation. Okay, now I will proceed to the introduction. And in this introduction, I will explain about what is organophosphate and the symptoms that the patient had. Organophosphate is a chemical that is produced by the process of esterification between phosphoric acid and alcohol. When organophosphate undergo hydrolysis, it will release alcohol from the esteric bond. Organophosphate mainly used in herbicide, pesticide, and insecticide for killing many types of pests, for example, termites, roundworm, and also mosquito. The exposure of the organophosphate may cause chronic and acute effects depending on the toxicity of the exposure, where the acute toxicity is where the symptoms will show rapidly after one exposure. However, for chronic toxicity, the symptoms will show after several exposure because this toxic chemical builds up in our body. Next, the symptoms of the patient in the trigger had generally affecting the nervous system, where he experienced nausea, vomiting, generalized paralysis, and he unresponsive to deep pain. He also had some GI tract problem, where he had diarrhea and also urinary and fecal incontinence. Next, I will pass to the next presenter to present about the causes of the toxicity.
Next part will be the causes. I am Noashikin binti Muhammad Zawawi. Looking at the picture there are three. Exposure to organophosphate pesticides may happen through inhalation, skin absorption, and ingestion. The most common ones are products of food treated with organophosphate herbicides or insecticides. If the pesticide is liquid and greasy, or if the skin is inflamed, cut, or bruised, the pesticide will be absorbed more quickly through the skin. It enters the lung in the form of dust or air droplets, including gas or vapors. Exposure to these chemicals may occur in public buildings, schools, residential areas, and agriculture areas.
Assalamualaikum everyone. Now I will continue the presentation by explaining the mechanism of action of the organophosphate toxicity. So organophosphate can be absorbed via the skin through inhalation and also gastrointestinal tract. Once it is being absorbed, the molecules can bind to the acetylcholinesterase in the red blood cell, thus making the enzyme less or not inactive. So in the yellow panel below, normally acetylcholinesterase catalyzes the degradation of neurotransmitter acetylcholine in the synapse. However, as you can see in the red panel below, when there is an exposure to the organophosphate, it will phosphorylate the acetylcholine, thereby reducing the ability of the enzyme to break down the neurotransmitter. As a result, This leads to an overabundance of acetylcholine within synapses and neuromuscular junctions. That is all for the mechanism of action. I pass to the next presenter.
Moving on with the next part of this presentation, which is effect of the pesticide toxicity. The effect can be divided into two parts, which are dermatological effect and neurological effect. During the first decades of using pesticide, the main problem was the risk of acute intoxication among people occupationally exposed. With decrease in the toxicity of improved pesticide, attention was turned to chronic intoxication and environmental contamination. Nowadays, the problem of disease not immediately related to the toxic potential of pesticide gain increasing interest. The majority of these non-toxic diseases are dermatoses. Most pesticide-related dermatoses are contact dermatitis, both allergy or irritant. Rare clinical forms also occur, including urticaria, erythema multiforme, skin hypopigmentation, nail and hair disorders. Farmers exposed to arsenic pesticide are at risk of occupationally skin cancer, mostly morbus. In addition, dermal exposure happens when the skin is exposed to pesticide. This can cause irritation or burn. In more serious cases, skin can absorb the pesticide into the body, causing other health effects. Some pesticides evaporate more easily than others, so they are more likely to be inhaled. Neurotoxicity can be defined as any adverse effect on the central or peripheral nervous system caused by chemical, biological, or physical agent. A large number of chemicals has been shown to cause neurotoxicity. These can include metal, industrial chemicals, solvents, natural toxin, pharmaceutical drugs, and even pesticides. From a general mechanistic perspective, neurotoxicants can be divided into four groups, which are those which cause neuronopathies, those which target the axon and cause axonopathies, those inducing myelonopathies, and those affecting neurotransmission. A number of chemicals can cause toxicity that result in the loss of neurons, either by necrosis or apoptosis. Most pesticides are not highly selective and are also toxic to non-target species, including human. A number of pesticides can cause neurotoxicity. Insecticides, which kill insects by targeting their nervous system, have neurotoxic effect in mammals as well. This family of chemicals comprises the organophosphate, the carbamates, the pyrethroids, the organochlorines, and other compounds. Insecticides interfere with chemical neurotransmission or ion channel and usually cause reversible neurotoxic effect that could nevertheless be lethal. Some herbicides and fungicides have also been shown to possess neurotoxic properties. The effect of pesticide on the nervous system may be involved in their acute toxicity, as in case of most insecticide, or may contribute to chronic neurodegenerative disorder. Most notably, disease was Parkinson's disease.
For the treatment, if an affected person has been poisoned by organophosphate, decontamination should continue simultaneously with resuscitative and anecdotal measures. Protective apparel together with rubber gloves must be worn when decontaminating patients exposed to organophosphate compounds. If patients are cooperative and able, they will help with their personal decontamination, remove apparel and private property, and double bag them. Clothing and leather-based items are tough to decontaminate and in many cases should be incinerated. Atropine is the number one antidote for adverse muscarinic effects. Flush uncovered pores and skin and hair with plain water for 2 to 3 minutes, ideally below a shower. Then wash 2 times with mild soap. Be sure to clean below fingernails and in all pores and skin folds. Rinse very well with water. If the affected person's eyes have been exposed, Irrigate them with plain water or saline for 5 minutes. Remove contact lens if present. Next, prolidoxime is an oxime that breaks the bond in the ACHE phosphate complex. However, in certain carbamate poisonings, for example, carbaryl, 2-pump is usually of limited value and can be hazardous if a combination of carbamate and organophosphate poisoning has happened, or if the pesticide cannot be identified. 2-pump ought to be administered as quickly as possible. Administer 2-pump but within 48 hours after organophosphate exposure. Beyond this time, ACHE or acetylcholine can turn out to be firmly bound to the phosphate in an aging process, which ends in the enzyme turning into refractory to reactivation. That's all for my part. I'll pass to the next presenter.
So I will proceed with the preventions. So in order to prevent pesticide toxicity or poisoning, the first is to read the label, which is prior to utilizing a pesticide. This is to determine its toxicity as well as to determine the recommended protection and first aid procedures. The second one is to choose the better option, which is when spraying, do choose the least toxic chemical possible. The third one is to inform the others, which is if we must to spray alone, please notify others of when you will be spraying and how long you will be gone. And the fourth one is transport of pesticide. So the pesticide containers are not to be transported or carried in the cabin of trucks or utes or in the car's passenger seat. Place securely the containers in a spill tray or separate compartment. The fifth is in mixing chemicals, which is we must pay extra caution during the process of mixing chemicals as they are highly hazardous when in the concentrated form. The sixth one is the caution insights, in which we have to also pay extra caution during pesticides application and when entering or working in the treated areas after spraying, as the risk of poisoning is greatest at these times. And we also have to follow the re-entry time on the pesticide label. In order to reduce exposure to pesticide toxicity, it is better for us to opt for alternative cropping systems that are less dependent on pesticides, such as biological control. And also, in utilizing the personal protective equipment or PPE, which is to reduce the dermal contact between pesticide and us. To conclude, pesticides are very helpful and are useful agents for pest control in agriculture, but also carries potential hazards. And if possible, opt for replacement for pesticides such as biological control. If also possible, opt for a more eco-friendly non-hazardous pesticides such as organic pesticides, and always exercise extreme caution in handling chemicals, not just pesticide but other chemicals also. So that's all from us. Thank you.